Hello, good to see you here. For those of you who have not come across me before or met me, my name's Elaine. I'm a doctor of psychology, and I'm going to take you through an assessment session, exactly the same as you would get if you were with me in person. Some people like to know my academic background, so I'll get that out of the way before we begin. I'm a doctor of psychology. I also have a master's in psychology and an undergraduate in psychology. I'm a member of the British Psychological Society, and I'm also a member of the UK Society for Behavioural Medicine. Now that I've got the credentials and jargon out of the way, we can begin. I'm assuming that you're with me today as you're looking for help for anything that falls under the umbrella term of anxiety. This includes, and it's not an exhaustive list, stress, anxiety and panic, work-related stress, health and social anxiety, as they all follow the same treatment format. Now we can start the assessment, and I want to start by asking you a few questions first. And the first one is, do you have asthma? Do you have any problems with your thyroid? Or do you have any heart-related problems? Don't just skip through this section of the video. I'm actually asking you the questions. What you're getting here is a proper psychological assessment. You won't get this if you go to general counselling, so take it seriously, as I'm trying to determine whether you have an underlying organic problem or whether we can start working straight away, assuming that you've got anxiety. As asthma, thyroid problems and heart problems can mimic the symptoms of anxiety. So if you have any of these things, get them checked out to make sure they're under control. If you don't have these things, or you have them and they're under control, well then we can start looking at anxiety. Okay, if we're happy there are no physical reasons why you should be feeling the way that you're feeling, we need to test to see if it's actually anxiety or not. Now, you can stop the video if you want. You can just pause it and go down to the next lecture where there's an anxiety test. So go down and check your own stress levels and then come back to this when you're finished. There are guidelines that tell people like me what to do to help people like you. They're to ensure quality standards. I'm going to talk to you about the NICE guidelines. That stands for the National Institute for Clinical Excellence, and it's there to protect the public. Now, the NICE guidance under anxiety and stress-related conditions, there's two pathways. Pharmacology, that's medication, but I'm a psychologist, I don't prescribe. And the second one is psychological therapies. That's where I come in, and I can talk to you about that now. Under psychological therapies is the gold standard, cognitive behavioural therapy, CBT. I trained in CBT during my doctorate. As CBT is a recommended treatment, you can see if you scroll down, I've included a complete cognitive behavioural therapy section as part of this course for you. This style of working lends itself very well to online programs, as the research is showing us that interactive CBT, online CBT, is as effective as seeing someone in person. So you're safe there, and it's all included further on down in the course, so I won't go into too much detail about it right now. In addition to CBT, I've also dedicated quite a lot of this course to neuroscience, information on how your brain works, how your brain does stress, basically. Now, why I've done this is very simple. There are different pathways in your brain that can create anxiety. And this is left out by so many people when they try to help people recover from anxiety. And in my opinion, it's fundamental, it's core to recovering from anxiety. You have to understand your brain. So getting back to the assessment, in order to help me help you decide whether this course is going to be suitable to you or not, whether it will actually help you, I need to ask you a few more questions. Do you feel anxious for no particular reason? Just the anxiety strikes out of the blue almost. 1 minute you're just going about your business, and then for no reason you just suddenly feel anxious. This is as good a reason as any to include neuroscience and not just do cognitive behavioural therapy, because if this is you, we need to do a little bit of work on a primitive part of your brain that just feels fear. It reacts sometimes for no reason. Or do you feel anxious in similar situations? This could be, for example, in work, giving presentations, out shopping or travelling on airports, buses, trains, anything that's similar. Do you keep getting the same old anxiety? If you recognize yourself in this, then in the course, the cognitive behavioral therapy will be useful to you, but also the information on how your brain works, particularly memory, how your brain remembers to be anxious, will help you understand this a bit better. Or do you find that you're stuck in your head a lot, that you're anxious in your thoughts and your worries? You might be worried about giving the presentation, going shopping or traveling. You can worry about anything really. It could be money, work, your health, the future, families, friends, anything that just keeps going round and round in your head and stressing you out. In this case, in addition to CBT, we are really looking at the habits that can form in your brain, the little grooves. And we are looking at the last part of the human brain to evolve, the thinking part of the neocortex to be precise. So in this case, it will be CBT and information on your brain that you will be using throughout my course. So if you recognize yourself in any of this, and we've already cleared that you don't have any underlying health problems that may be causing your anxiety, it looks like my course suits you, but we need to find out now, do you fit the course? Let me start by telling you there is no quick fix for anxiety. Now, I've come across all sorts of wonderful cures and claims that we can get rid of anxiety and panic attacks in 20 minutes with no effort in your part. It doesn't exist. I've been doing this for an awful long time. I'm really well qualified and I'm considered an expert in anxiety. The research tells us if you want to recover, we have to look at your brain. We have to get you to do things differently. And this takes a little bit of work in your part. Now, I know this as well on a personal level, as you may or may not know that I had anxiety and panic attacks myself in the past. That's the main reason that I have researched it so extensively. As one, I wanted to get rid of it myself, and two, now I want to help other people with it. There's no quick fix. You have to put the work in. Now, whether you were sitting with me in my office or listening to me in this course, I always get asked, well, Elaine, how do I know it'll work? And I give the same answer. It really depends on you. I won't say something at some stage and the light bulb will go on and it will all miraculously disappear. That won't happen. It depends on whether you do the things that I tell you to do, either in person or through this course. You have to put the work in. Now, it's not laborious. Part of it's enjoyable. Most people like taking the course. But you have to put the work in, and over a period of weeks, you'll start to see the anxiety disappear. So that's what you need to decide. The course, it fits you, but will you actually do some of the things to help yourself recover? And if you will, well then let's get started.